Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Cathy Wendland-Colby, speaking on the 5 aspects of health during pregnancy and beyond. Dr. Cathy Wendland-Colby is well known for her work with pregnant women and young families. She lectures around the world on the importance of improving our lifestyle because healthy moms equal healthy babies. Her lectures take people out of their comfort zone by dissecting the medical model forced on our society and replacing it with a natural approach, the chiropractic approach, to healthy pregnancy, birth, and parenthood. You can see some of her work at educatedpregnancy.com or on her YouTube station at Dr. Cathy. Her purpose is to educate as many people as possible how to live a healthier life because she recognizes that babies aren't pincushions, kids aren't guinea pigs, and no one should be treated as a human lab rat. She believes that every person has the right to experience life to its fullest potential without drugs, without interference, and without limitations. Her mission is to educate and lead her community to raise healthy, unmedicated families. Welcome, Dr. Cathy.
Well, welcome. Thank you. Thank you so much for having me.
Yes, I'm excited. And, you know, as I'm reading your bio and your mission statement, I can really resonate with what you're saying as a fellow chiropractor who values family wellness practice. There is such a brainwashing that's occurred in our country about what health is. And so I'm just thrilled to know that you're on a mission to spread the good word.
It's interesting that you use the word brainwashing because we use that word as well. And it really is a brainwashing propaganda situation that we have in this country, and it does go in many other countries as well. But it's really very evident in the United States because from the instant of conception, we start scaring women into believing that their bodies are just not strong enough, capable enough, healthy enough to make it through a pregnancy for the next 40 weeks and to have a healthy, normal, natural birth. So we set this whole scare tactic, fear-mongering propaganda machine into action the instant the woman conceives a child, and then we continue this machine for the rest of that child's life. So it is. There's a genuine brainwashing that goes on, and I think that we, as people with an education, have an obligation to share the truth with everyone we meet.
Mm-hmm. Yeah, it's so important just to have families recognize really what their options are and really making a decision based on education and empowerment as opposed to fear, which I find a lot of families are actually coming more from that perspective because that's what's taught typically in the allopathic medical model.
Exactly.
Yeah. So I know that your education includes 5 areas of health, and this is really not about the absence of symptoms, but this is really about an optimal functioning body. And there's 5 areas that you relate to really what health is. So I was hoping you could go through and share with our audience what these 5 aspects are.
I would love to. Thank you. Well, the way we teach it to most of our members and to the women that follow along with us is that life should be a dream. And we use the word dream because it's a great way to help the people remember the 5 aspects of health. So if we look at the letters in the word dream, the first letter is D, and D stands for diet. And we always tell people that it does not mean that you go on a diet. It means that what you consume on a normal daily basis, that is considered your normal daily diet. And it should consist primarily of foods that grow. So we teach our moms that if they're filling their body with junk, then those are the building blocks that they are providing for that baby that's developing within their womb. However, if they're choosing healthy, normal, natural foods, things that grow, such as fruits and vegetables, lean meats, chicken and fish, if they're choosing those as the foundation of their normal daily routine, their normal daily diet, their plate every day when they sit down to eat, if those are the foundational foods that they're using, then those are the foundational blocks that they're providing for that developing baby within their womb. Because after all, the body can't make what it doesn't have. We understand when it comes to breastfeeding that our bodies will do exactly what it needs to do in order to provide the best quality breast milk for our babies. Now, it will sacrifice quantity if we're not getting enough nutritious foods, but it will never sacrifice quality. Your body will do the best that it can to make good quality breast milk, providing by the building blocks that you give it. So if you don't give it enough healthy, nutritious foods, then it will only make a small quantity, a small amount of breast milk. So if that holds true for our breast milk, then it certainly holds true for the baby that's developing within our womb. If you don't provide your body with the best nutrition, then you certainly can't provide your baby with the best nutrition to be built with. They've actually done studies where they've proven that the dad's nutrition prior to conception alters his sperm and therefore alters the genetic makeup and the quality of the sperm that he's providing, therefore the quality of the baby that's being produced within the mom. So we understand that nutrition is one of the 5 factors that always must be considered in anybody's quest for health, especially when we're talking about the most important 40 weeks of a woman's life and the most important 40 weeks of any one of our lives, because after all, what our moms did when they were pregnant with us helped to shape who we are at this point in our lives.
Mm-hmm.
The next letter in the word dream. Yes, go ahead.
Yes, I love that you talked about Dad's diet as well. That's come up a few times with some of my episodes. I really want to, hammer in that, it takes 2 to make a baby. So much, focus is put on women regarding fertility and conception and the health of that fetus. But we also have to, get support from Dad as well and have him doing a healthy diet to help create the best 50% of the genetic makeup of that baby.
It's so true, because we have such a misnomer in this country that fertility is strictly a woman's problem, and it's not. The reality is that 1/3 of all fertility challenges, and we don't ever call someone infertile. I just don't like that word. I think that it takes away hope, and it's an unempowering word. 1/3 of all families that are experiencing fertility challenges, it's strictly due to the woman's body. In another 1/3, it's strictly due to the man's body. And in the remaining 1/3, it is a combination of both the man and the woman in that relationship presenting some form of fertility challenge. So anytime we talk about our 5 aspects of health, how life should be a dream, it applies not just to the woman. It applies to the dad, and it applies to the other children in the household, because realistically we want to impact everyone, but we understand that in most situations and with the people that we encounter, it starts with the woman first. And if we can get the woman to start making healthier decisions, she's going to make those decisions for herself and her family. So all of these apply to the male as well. All of these apply to the rest of the family members. So
Sure.
Diet is the first on our list, just because we go in that order of life should be a dream, and then we come to rest. And rest is one that we see so many people in our country just not getting enough sleep. They're not getting enough restful sleep. And we say that you should have adequate and restful sleep, which is different for every person at every age and every background. Because here's what happens. Babies, we understand that a newborn baby is going to sleep, nurse, sleep, nurse, sleep, nurse all throughout the day. And they'll probably nurse 15 to 18 times a day if you allow them to nurse on demand. But they're only going to drink a very, very small amount, and then they're going to go back to sleep so that their body can do what it needs to do, which is build and grow and develop. And then as that child gets to be a toddler, they no longer need the same amount of sleep. Their sleep needs go down a little bit. And then children of young age have a little bit less of a need for sleep. And then as we get to be teenagers, our need for sleep increases because, again, we're going through the changes. We're going through the hormonal changes. We're going through, girls are starting their first menstrual cycle, and boys are starting to get that deeper voice. So as their body puts greater demand on all of the functions, all of the organs, and all of the systems, our need for sleep increases. And then there are adults who get by on 3 or 4 hours a night, but is that truly helpful for them? And the research says that no, it's not. They do need more sleep. So we are chronically overtired, most people in this country, because look at what happens. A lot of people spend an hour or 2 hours commuting each way to work.
Right.
They spend 8 hours sitting at a desk. They don't have time for exercise. They don't have time for outdoor activities. They come home, they're exhausted from a long day, and they basically plop down on the couch and sit there all night until they're so tired they can stumble off to bed. Well, we need to change that routine, and we change that routine through the 5 aspects of health. But when it comes to rest, we really need our people to start understanding that is when the body heals. If you can't sleep, you can't heal. So if we have a chronic illness and we're not sleeping enough and we're not taking care of ourselves, we're going to allow that chronic illness to continue without interruption because we're not stopping the process. So the second step in the 5 aspects of health is adequate and restful sleep.
Mm-hmm. Awesome.
Now,
that's so important. And I think I just wanted to mention a little bit more about the sleep. There's so many people that are sleep deprived, and then what we see that comes out of that with adults is a dependency on caffeine. And so then there's creating that, cycle of sleep deprivation and then needing some caffeine to wake up. And then what I see for women that I do preconception work with, they might have some adrenal fatigue, and they're certainly consuming a lot of caffeine every day, and caffeine is linked to miscarriage. So having that awareness that allowing your body to rest and to rejuvenate and healing your adrenals and weaning off the caffeine can really be helpful for getting pregnant.
And one of the best ways to wean off the caffeine is to just increase your water intake significantly. When people first wake up in the morning, if they would just drink a big glass of water, it would get their digestive system started for the day. It would lubricate their body. It would start everything going. It would start all of their metabolic processes going. And it will actually jumpstart your digestion, which means you're going to have a bowel movement in the morning when you first wake up, which you should do because that helps clean out the garbage from yesterday. But it's also going to give you a little bit more energy. And if throughout the day, rather than relying on caffeine, which we don't touch caffeine, I don't never have since I was probably 10 or 11 years old. Don't drink soda. Don't drink coffee. I strictly drink water or some juice. If we make that shift, if we as a community, if we as a population make that shift and get rid of the soda, get rid of the caffeine, get rid of the coffee, and start replacing it with water, we're going to see such a tremendous shift in us because, number one, we're not filling our bodies with empty calories. Number two, we're not relying on caffeine to give us energy. And number three, water is going to give you the energy you need, but it's also providing your body with what it needs to run at a normal, healthful pace. So I think that water and caffeine are a huge part of the discussion, and it should be introduced early on in your conversations with any family that's talking about starting a family because they've got to get that caffeine out of the system because we know how detrimental it is not only to their body but to that developing baby that they hope to have. Yeah. The next letter in the word dream is the E, and E stands for exercise. And exercise should be on a regular daily basis. You know, the minimum recommendations out there are that you should have 20 to 30 minutes 3 to 5 days a week. And the reality is that's just not enough. It really isn't. That's not enough to see any type of gains. That's barely enough to even maintain the level of health that we are at. So if we want to see significant gains, if we want to start to get healthier, if we want to change our lifestyle, if we want to get our bodies in better shape so that we can prepare for that healthy baby, if we want to prepare the vessel to be able to carry that beautiful baby, then we need to do more exercise than 20 to 30 minutes a day, and it needs to start now. It doesn't need to wait until we're pregnant. It doesn't need to wait until after we've had the baby. It doesn't need to wait until we decided that it's time to get the baby's weight off of us. It needs to start today because when we start to exercise, we increase our body temperature, we increase our blood flow, we open up the blood vessels, we get more blood to more organs, we start the body working at a higher level. And through exercise, we keep the body functioning, moving, so that everything can form and develop and act the way that it's supposed to. Now, when we move our muscles, we're using more calories. We're burning off more energy. When we use our muscles, we're also keeping them full and strong, full of blood, so that we are strong enough to maintain a healthy pregnancy. I think that exercise during pregnancy is not just something that we should recommend. I think it should be a requirement because when a woman exercises during her pregnancy, she is healthier. Therefore, her baby is healthier. The amount of blood that's flowing through her body and to the uterus is increased so that the baby's getting the best source of blood, the best oxygen, higher levels of oxygen concentration in that blood because of the exercise. And it keeps the weight low so that we don't run into risks of the baby being overweight or the mom developing gestational diabetes. It lowers those risks, and it helps the pregnancy because a woman who exercises is going to feel great throughout her pregnancy rather than feeling like she's overweight, rather than feeling like there's excess weight on her hips, or rather than feeling like she's got low back pain. She's going to stay active, and as her body is growing and the belly is pulling her forward, she's going to remain dynamic if she's exercising so that her body can respond very well to all the changes going on throughout the pregnancy. which leads to an easier birth. And that is probably one of the best reasons that most women will choose to exercise. The top 2 reasons they'll choose it is to not put on too much weight, make it easier to get the weight off after the baby's been born, and to have an easier birth.
Yeah, so important. And, I'm glad that you mentioned about the gestational diabetes component, too, because that's definitely linked to being overweight or obese going into the pregnancy. So, ideally preconception, it's also getting your body to a healthy body weight so that there's less risk factors. And the way to do that is through diet and exercise.
We have a neonatal intensive care unit nurse as one of the advisors on educated pregnancy. And we have such great conversations about what really goes on in the NICU and why things go on in the NICU. And one of the underlying causes of why babies end up in the NICU is because the mother was high risk. And now if you step back a little bit further and you ask, why was the mother considered high risk? The number one reason is because the mother was overweight. And by overweight, I don't mean 5 or 10 pounds. I mean obese or morbidly obese. These are women who were not healthy in the first place. A lot of them went through some fertility procedures, introducing some of the drugs into their body to try to help themselves get pregnant because their body was already saying, listen, you're not healthy right now. This isn't the best time to bring a baby into your uterus. Your body was saying, let's wait, let's get a little bit healthier. But we've overridden some of those signals that the body gives us, and we see women who were not healthy to begin with get pregnant and then be labeled as high risk. Once they're labeled as high risk, they typically will spend the majority of their 40 weeks in bed or on light activity, which allows them to gain more weight, which allows them to do less exercise, which produces less blood and less oxygenated blood for that developing baby. So everything sets the baby up for failure. The excess weight on the mother, the excess weight on the baby, the decrease in exercise, the decrease in oxygenated blood, all of this affects the baby. And then when the baby is born, they're whisked off into the neonatal intensive care unit because, first of all, that mother couldn't push. That baby was probably taken out through C-section. That baby was exposed to some drugs during that C-section process. And the baby is taken away because the baby is now struggling because the building blocks weren't there throughout the pregnancy. The healthy lifestyle was absent throughout the pregnancy. So we're very big on making sure that not only do women understand that exercise is important during pregnancy, but that exercise is a necessity in order to give your baby the best chance at having a healthy lifestyle.
Thank you for sharing that. That was really powerful.
Well, thank you. Absolutely. Now, as we move through life being a dream, our next letter that we come to is A. And A stands for attitude. And you've got to have a positive mental attitude. As a mom and a dad, everything that you do, everything that you say, the words that you think that nobody hears, the tone in your voice, all of that is conveyed to your child, born or unborn. All of that goes right into their subconscious mind. Our babies are sponges, and they are picking up everything that we see, everything that we do, everything that we behave like, the actions that we portray when we're going throughout our day-to-day business in front of our children. They pick all of this up. And they actually did a study in Italy with a pregnant woman. And they introduced screaming and loud noises while the baby was under an ultrasound. And the reaction of the baby was so severe. Like the baby curled up into a fetal position and the baby just responded with such angst to the mother's voice and to the screaming going on around the unborn baby. This wasn't a baby that was able to hear it through their ears. This was a baby hearing it through the womb, through all of the coating and the fluid that the baby is bathed in. And the baby responded in fear. And what we found is that these babies develop their brains differently than a baby who is bathed in beauty and love and peace and harmony. The babies that are surrounded by maternal stress, their brain development is altered. And these children are more likely to have aggressive behavior. These children are more likely, they've actually tracked over the years, these children become what is labeled as street fighters. They just have that angst, that violent tendency, that eagerness to just confront people and just get in people's face, and they've linked it back to what goes on during the pregnancy. So it's so important that a woman understands that during those 9 months, everything that she is exposed to, her baby is exposed to. So whether that's caffeine, whether that's cigarette smoke, whether that's alcohol, or whether that's a stressful situation at work where somebody's screaming and yelling at her, or, gosh forbid, family violence, which is one of the number one things that harms unborn babies is family violence. So we have to make sure that none of that is going on in the household, that the woman is not exposed to that, and the woman has to do everything possible to maintain a positive attitude during her pregnancy. I'm one of those women who absolutely loves being pregnant because when I'm pregnant, no stress is allowed in my life whatsoever. And because I don't allow any stress and I'm just so carefree and happy and just so wonderfully loving and peaceful and so in love with the baby, everyone that I encounter seems to give me back more of that. More people open the door for you, even when you're not showing. More people stop and say hello to you. It just radiates from a pregnant woman. And if we can remember that, everything that we are exposed to, our baby is exposed to, then we'll make better choices and we'll make sure that there is no screaming and yelling. There is no negativity. Nobody should be telling you their horror stories about their birth when you're pregnant. You don't need to hear that. You need to hear uplifting, empowering information when you're pregnant. And you need to talk to your baby in the womb with uplifting, empowering words of praise and appreciation and affirmations of how wonderful and smart and beautiful and healthy that baby is. And start laying those foundational blocks for that child's lifelong attitude, their self-confidence, their self-worth, their self-esteem. Start putting those into place now so that you can really build your baby up in strong and noble thought. And as you do it for your baby, you'll realize that you're actually doing it for yourself as well. So having a positive mental attitude is one of the 5 aspects that we absolutely insist that women try to incorporate into their life. It's huge. And when you do it for yourself, you'll see that your partner, your spouse, your other family members, they'll start to follow along because who doesn't want to be around a positive person, right? Nobody wants to be around a negative Nelly, but everybody wants to be around the positive people because it's so fun and it's uplifting and it's elation and everybody needs more of that in their life.
That's right. And the other thing, too, is like we know now, from research that there's Molecules of Emotion by Candace Pert was the first to talk about how our thoughts will actually change our biochemistry. So during pregnancy, whatever a woman is thinking about, she's either creating positive neurotransmitters or potentially negative stress-related neurotransmitters and hormones. So it actually gets into, from a biochemistry perspective, you can get into the, the umbilical cord and pass to the baby.
Absolutely. There was a study where the scientist took fluid and cells from inside of his mouth and he put it in a petri dish, and he was on the other side of the room. And he would say negative words over on the other side of the room, and his cells and the fluid from his mouth that were in the petri dish 10 feet away reacted. So we cannot go around in our lives and think for 1 second that how we feel, how we act, what we expose ourselves to, and the way we react to situations doesn't have an effect on our bodies, because it absolutely does, and it absolutely has an effect on our children, born or unborn. They pick up what we're putting down. And we've got to be conscious of that, because all too often we see parents, you see it in a grocery store all the time, right? There's a child yelling and the parent screams at them, "We don't yell." Or a child hits another, so the parent hits them back and says, "How many times do I tell you, we don't hit in this family?" What are you teaching them? This is not the do as I say, not as I do generation. This is the I'm going to watch you and learn from you and behave just like you generation. And if we start to realize that, if we start to get that into our brains, and we promise to never forget it, then we will act better, think better, say better things, behave better when no one is watching and when everybody is watching, because our children, whether we realize it or not, are always watching how we behave.
Yes, and that's such a good point. This is super important during pregnancy, but this is really a lifestyle that you can start to create now, and it will impact your family for the rest of their lives by showing that example.
Right. And it's attachment parenting or peaceful parenting, but it's mindfulness is what it really is. It comes down to before you say something. And look, we've all had situations with our children where you want to just kind of go, really, for the 10th time I have to say the same thing over and over again. But to step back for a minute and realize that they're learning and they're excited and they're intrigued by everything they see. So when you say, come on, it's time to go home, sometimes they're so excited because it might have taken them a little bit longer than you to warm up to the place that they're at. And now that they're finally warmed up to it and they're having a great time, and we say, now it's time to go home, they don't want to go. So think about how you respond in that situation and how you can do that situation better. Sometimes it's as easy as giving your children a little bit warning. Listen, guys, you've got 10 more minutes to play. I just want to let you know, enjoy yourself, have fun, but in 10 minutes we're going to get going. And then maybe in 5 minutes you check back in and let them know the same thing rather than just springing it on them that, okay, it's time to go, pack your stuff up. So all of that can lead to better communication and it can lead to better responses from our children if we learn how to treat them with love and respect. It's one of the things I tell both of my children. Anytime they're having any kind of communication with each other where things might be, a little bit uneven, where one person wants something the other person doesn't want to give, we always say, treat each other with love and respect. And if you do that, if you treat yourself with love and respect first and foremost, and then you treat your partner and your children that way, you are going to change the vibration in your household. And you're going to change the attitude and the self-worth and the self-confidence of each member of your family. And it's huge. It's needed. It's absolutely needed in this day and age.
Mm-hmm. Yes, I agree.
Now, as we move on through the dream life, we come to M, and the letter M stands for mental impulse. And mental impulse is such an important factor. It should be number one, but it's actually at the bottom of the list because it is the cornerstone, it's the foundation upon which all else is built. You can have great nutrition, you can have plenty of rest, you can exercise on a daily basis, and you can keep a positive mental attitude. But if your mental impulses cannot flow freely and uninhibited from the brain to the body and back, then your body is not able to function at its best levels. All the exercise in the world won't get through a subluxated spine, just like all of the proper nutrition in the world. If your body can't assimilate that nutrition and break it down and use those building blocks, then you're just having very expensive urine and very expensive feces. So what we need to do is we need to make sure that the body can function freely without interference. We understand that in a newborn baby, step it back further, in a newly conceived baby, the very first structure to develop is the brain, followed immediately by the spinal cord. Once the brain and the spinal cord develop, then they send out little buds that then become nerves, that then become limbs and arms and legs and fingers and toes and eyes and ears and nose and mouth and heart and lungs. But if first the brain and the spinal cord don't develop, then a baby doesn't develop. Because the brain and the spinal cord are so important. They are the master control system of the human body. And they are the ones that determine how the body grows and develops so that every organ, every system, and every tissue can function while that baby is developing within the womb. But it doesn't stop there because after that baby is born, the brain and the spinal cord, the nervous system will continue to control and coordinate the function of every cell, every tissue, every organ, and every system in that person's life for the rest of their life. So from the instant of conception until you take your very last breath, you have a master control system, the nervous system, your brain and spinal cord, constantly monitoring your environment, picking up feedback from everything that you see and hear and smell and taste and touch and the chair that you're sitting on and the clothes that are touching your body and the air that you're breathing and the food that you put in. It's constantly picking up all of this sensory input, sending it through the nervous system, up through the spinal cord, up to the brain, where the brain can instantaneously process it and send a signal back down through the spinal cord, out the nerves, to wherever those nerves need to go to tell your body how to react. So, for example, if you step on a piece of glass, your brain instantaneously gets the signal, and your brain sends a signal back that says, lift that foot up, get off the glass before it cuts us. Now, if that system wasn't working, if there was interference along the line, then as you stepped on that piece of glass, you wouldn't just barely rest your foot down. You would actually step fully down on that glass, you'd cut your foot, and then the body would have to respond in a different way, which would be bleeding and clotting factors and platelets and flushing out the garbage that got in there in the first place. But all of that is also controlled and coordinated by the nervous system. So it's important that we understand that the nervous system needs to be in perfect balance. We have to make sure that there's no interference. The way that we get interference to the nervous system is by having stress. There's 3 types of stress that we're exposed to on a daily basis: chemical, physical, and emotional. Chemical is the food we eat, the air we breathe, the junk that we put into our bodies on a regular basis, the lotions and the potions that we put on our skin to try to make them healthier, and the hair creams and the hair gels and the hair dyes that we use. All of that is getting into our body, and we have to process it out. But if we get too much, we may be overloaded, or we may not be able to process it out because maybe something's not working properly in the human body. Now, physical stresses on the human body can be the position that you sleep in, or the long drive that you do on your way to work with your commute every day, or the way that you work. If you're a hairdresser and you're bent over people with your arms up all day long, or a dental hygienist who's leaning over the chair with her head forward and her arms extended, or someone who spends a lot of time on a computer constantly looking down at the keyboard or with their head turned to the side to look at their monitor, you're putting some physical stress on your body. You're putting your body in an abnormal position, and you're expecting it to stay there for long periods of time. So those are physical stresses, and those physical stresses can build up in the body, and over time what we will see is that the body starts to not function at 100% because these physical stresses are starting to wear away at the spine and at the muscles that hold the spine in place. Now, the third stress that affects the body, we've got the chemical, we've got the physical, but we have the emotional. And the emotional cannot be overlooked because the emotional is there all day, every day, whether you realize it or not. You know, they actually say that in domestic violence, the emotional abuse is more damaging than the physical abuse. Why? Because physical abuse leaves a bruise, leaves a mark, leaves a scar, a cut, bleeding, that the person who's being abused sees. They recognize it. They may try to deny it, but it's there. It's present. It's a reminder. It's a signal that something went on. With emotional abuse, there's no signal that it went on, and it may take years for the symptoms to show up. So emotional stresses are so damaging if we allow them to be, because oftentimes we've just been programmed to ignore it or block it out. I mean, how many times have we seen, or as children ourselves, how many times were we told, suck it up, don't cry, there's nothing worth crying about, stop crying or I'll give you something to cry about, right? It's emotional stress that we were told that our feelings weren't valid, and we had to stifle them. You know, you're acting like a baby. Quit acting like a girl. Quit acting like a boy. Act like a man. All of these things were ways of telling us that our behavior was not appropriate. And those are emotional stresses that were inflicted upon you and me and everybody in this world as children. And we continue to have those emotional stresses day to day throughout the course of our life. The bills are due. There's not enough money in the checking account. The project is due at work, but it's not done yet. You're not able to meet the deadline, so now you've got to work harder. But now that forces you to miss something that's really important to you. So now you've got that emotional stress of, oh my goodness, I'm going to lose my job, but I'm missing out on my family. So those emotional stresses can build up. And when they build up, people have tension. Their shoulders are raised up high. Their neck is tight. They get headaches. Well, all of this is a product of the body not being able to handle the excess amount of stress that we're putting on it. And so when we have that level of stress on our body, what happens is our muscles go into spasm. Those muscle spasms can pull on the bones that they're connected to, which can pull the bones out of position. The bone out of position can put pressure on the nerves as they exit through and in between the spinal bones. That pressure on the nerve can cause the muscle to go into spasm. That spasm then again pulls that bone out of place even more, puts more pressure on the nerve, causes the nerve to tell the muscle to go into spasm more, and we start to set up this cycle, this downward spiraling cycle of stress and its effect on the human body. Now, most people recognize stress on the human body when they realize that they've got a headache or they've got neck pain or back pain or their hands are waking them up in the middle of the night and they think that that's carpal tunnel, which it's not because it wouldn't wake them up in the middle of the night. Carpal tunnel is an overuse injury, not a injury that's bothering you during your sleep. But they start to recognize these symptoms, and because they have symptoms, then they may start to seek out care. Well, we as chiropractors look at the human spine and we look for any misalignment in the spine because we understand that the misalignment in the spine puts pressure on the nerves, and not just on the nerves that go to the muscles, but on the nerves that go to the cells, the tissues, the organs, and the systems. So where someone may have a misalignment in their neck, in their cervical spine, putting pressure on the nerves that go to the muscles in the neck, the shoulders, and the arms, they may have a symptom such as headache or neck pain, or their shoulders may be burning after a long day at work, or their hands may be going numb or tingly, or they may have no symptoms at all. But the same pressure that's on the nerve coming out of the neck bones that goes to the muscles is also on the nerve that goes to the heart. And so as the heart goes about its normal daily routine, its cells die and regenerate. All throughout our lifetime, this happens with every cell in our body. But if there's an interference to the nerve that goes to the heart, when those cells die and regenerate, we may not be getting 100% of the signal that we should to those heart cells. We may be getting less. And the same thing happens if there's a misalignment in the lower back to the nerves that go to the uterus. If we're not providing proper nerve supply to our baby as he or she develops in our womb because there's a misalignment in the spine, then our baby cannot develop at 100%. And maybe they'll develop at 99%. But do you want 99% or do you want 100%? I personally want 100%. I want 100% for me, for my children, for the families that we work with in our office, and for the families that we work with around the world through educated pregnancy. I want 100% possibility for them. And that's why mental impulse, the M in the dream life, is at the very bottom. That is the foundation. That is what has to be present in order for the body to function. So it is of the utmost importance that every member of the family is checked on a regular basis for spinal misalignment, making sure that their spine is in alignment so that they can minimize or reduce or eliminate any pressure on the nervous system so that their body can function freely without interference.
Well said. I think it's so important for families to really hear this chiropractic message. And, I've had a few other guests on the podcast that were chiropractors and took care of pregnant women and babies, like you and I both do. But it's always great to hear this message again. 5% of the population is getting regular chiropractic care or less in the United States. So there's such a component here to improve as a society how our nervous system functions and therefore how everything else is functioning by getting regular chiropractic care, not for pain relief, but really for optimizing the function of the nervous system. Absolutely. I think that pain relief is one of the smallest things that we do, and it is significant in people's lives because, let's face it, when somebody is in pain, they will do just about anything they can to get out of pain. So while we do help minimize pain or eliminate or relieve pain in people's lives, that's not our primary focus. We're better at it than any other doctor, any other therapist, any other treatment. We are way better at eliminating back pain, neck pain, and headache than anybody else. But that's not our true focus as chiropractors. That's just one of the things that the body is capable of doing. When you remove the interference, then you remove the symptoms as well. But we want to make sure that the whole body functions. This is not about how you feel. It's about how you heal. And we want to make sure that everybody can heal and function at optimal levels, whether it's a dad, a mom, a child, a newborn, a grandmother, or teenagers who need to spend the next few years preparing their bodies to get themselves healthy so that someday when they get married, their bodies are functioning at their optimum levels, and then when they decide to start a family, they are producing the best quality egg and the best quality sperm to give that unborn baby the best chance at health possible. So I think that chiropractic should be incorporated from the womb to the tomb, from the crib to the coffin, from the birth to the burial, any way you want to say it. It is a lifestyle that most people, we always cite the number of patients that are under chiropractic care, and right now there's no true study, but I can tell you this. I'm working very hard with a lot of great chiropractors to try to increase the number of people under chiropractic care, and we are trying to get to that tipping point of 18%, which is when the rest of the population starts to adopt the ideas that the forward thinkers are adopting. And we get to that 18%, we change the conversation in chiropractic completely. But we're only going to get to that 18% if we all start talking about the vitalistic way of life, about having the body function properly through chiropractic care, not just about back pain, not just about neck pain, not about headaches. It's not just about musculoskeletal, and it's certainly not about getting into bed with the drug manufacturers. This is about claiming our philosophy, owning it, standing on it, being proud of our principles, and promoting them, putting them out there so that people can start to understand them, because when your community starts to understand how you live, they want to live that way. When they understand what you do, they want to start to do it. But too many of us keep our lifestyles to ourselves, and we just talk about back pain and neck pain in our offices because it's easy. Well, easy isn't helping anybody. And if we start having the conversation about, I want to see your family in here, I want to see your relatives, I want to see your coworkers, I want to see
everybody in this community getting checked on a regular basis so we can detect and, if necessary, correct any vertebral subluxations so that their body can function at the best level, well, that's going to provide a better community for us, and that's going to provide healthier people that will grow up to have healthier pregnancies, healthier babies, who will then grow up to be a healthier generation. And that's how we change the world.
That was beautiful. It sounds so great. I just want to, if you could just spend a couple more minutes speaking to specifically the value of chiropractic during pregnancy in preparation for a gentle birth, and then also why newborns need to be checked by a chiropractor.
Oh, I would love to. Thank you.
Great.
So there have been studies that have shown that chiropractic helps alleviate back pain in women during pregnancy. And there have been studies that show that chiropractic helps alleviate colic. And there's been studies that show that chiropractic helps a baby to nurse better. But the real proof is in the patients. The real proof is in the people. The people validate chiropractic every day. When you have patients in your office who are pregnant, who have had a previous pregnancy when they were not under chiropractic care, maybe they weren't as healthy, maybe they weren't taking care of themselves, they've got nightmare stories. And their pregnancy while under chiropractic is significantly different. They'll talk about how they feel better, they have more energy, they're not as tired, their feet maybe aren't swelling, they don't have any back pain, and when it comes time for them to labor, they're going to labor significantly shorter time periods. They say that during the first pregnancy, a woman will have a 25% shorter labor time, which a shorter labor will lead to typically an easier birth because the mother is not exhausted. Now, in the second or future pregnancy, that mother under chiropractic care will have a 40% shorter labor time. And when we shorten the labor, we give the woman more ability to have a healthier birth because they haven't spent 8 or 10 or 12 or 16 or 20 hours going through contractual labor pains. They haven't had that time for their body to be working, relaxing. They've had a shorter period of that time, so they're more energetic, they're stronger, they're better able to go through a natural birth. Now, also, one of the things that chiropractic does is chiropractic keeps the pelvis balanced. Through the chiropractic adjustment, we make sure that the spine and the pelvis remain in proper function, proper alignment, and proper movement throughout the course of the pregnancy as that baby's growing and the belly's pulling forward and the low back starts to arch and the hips start to stretch out and the elastin and the ligament starts to loosen up. We, through chiropractic, keep everything moving properly. And when the pelvis can move properly without interference and freely without restriction, we put less stress on the uterine ligaments. And so we allow the uterus to take its normal shape, which should be that of, let's say, a hot air balloon. And if the uterus keeps that shape of the nice hot air balloon, then the baby can easily exit out the bottom toward the basket of the hot air balloon with the contractions coming from the top and kind of pushing the baby down. But if there's torsion on the pelvis, if the pelvis is out of alignment, then what happens is it pulls on those intrauterine ligaments. It pulls on the uterus. It pulls the uterus into an abnormal position, and so the baby may not be able to lie properly. The baby may not be able to get into a head-down position. The baby may be stuck in a transverse or a breech position. And so that's where adjustments come into place. That's where when we check the spine, we look for the balance, we look for the torsion on the pelvis, and we realign the pelvis through the chiropractic adjustment, which allows the baby a safe and easy passage through the birth canal naturally the way it was intended. And when we do that, we change that baby's life because we understand that a C-section child has a greater likelihood of developing diabetes throughout the course of their life. We understand that a C-section child is less likely to be breastfed exclusively for the first 6 months. More than likely, those C-section child, they're not going to be breastfed even for the first 6 weeks because what happens? During the C-section, there are drugs that are introduced to the mom's body. The baby is then taken away while the mom is stitched up, and the mom, who goes through that oxytocin letdown where she's supposed to fall head over heels in love with her baby, is laying on her back staring up at white lights with surgeons stitching her back up. Her baby's off in another room. She doesn't bond with the baby. She doesn't have the letdown of her milk. She doesn't get to nurse that baby right away. And so she may develop postpartum depression because she never fell head over heels in love with her baby because the baby wasn't there when she had that oxytocin rush. Now the baby who has been taken away to another room, did not go immediately to the mother, did not immediately nurse on the mother, was not suckling and getting the colostrum first thing. So that baby may have had a pacifier put in their mouth. or a bottle put in their mouth. Well, a bottle's a lot easier to get liquid out of than a breast is. So the baby may then not want to nurse because it's too much work. So we understand that if we change the pregnancy, if we improve the pregnancy through chiropractic, if we keep the body functioning freely without interference, if we keep the pelvis moving so the baby can exit properly, vaginally, naturally, then we change the birth process. And by changing the birth process, you change that child's life, because then a baby who's born naturally, vaginally, without medication, without a Pitocin, without an epidural, that baby is unmedicated. And that baby will be placed typically right on the mother's breast or on the mother's stomach, and that baby will work its way up to the breast to start suckling. And that bond will form instantly. And that mother who had a natural birth is more likely to maintain exclusive breastfeeding for a longer period of time, which decreases the risk of diabetes, decreases the risk of obesity for that child. It helps the mother take the weight off of her, but it also creates a lifelong bond between the mother and the baby, a very, very strong bond, and it helps boost the immune system of both mother and baby by nursing on an extended period. So through chiropractic, we can change all that. Now, if there's any difficulty with the baby nursing, they only want to turn their head to one side. Perhaps they were in an abnormal position in the uterus, or the cord may have been wrapped, and so that neck needs to be checked, that spine needs to be checked of that newborn baby to make sure that their spine can function freely without interference. Listen, the birth process is like somebody taking your head, the back of your head, and trying to slam a big round circle over it and just keep banging and banging and banging and banging until finally you can squeeze your way through that circle. And the babies are doing that because they are head down and their head keeps pushing against that pelvic outlet, and they keep being contracted against, and they keep pushing and pushing and pushing and pushing. And so all that pushing pushes the head down, the chin forward. It juts that chin forward. So we need to check the babies shortly after birth, as soon as possible, to see if there is a misalignment due to the birth process or due to the position that baby was lying in within the womb, and then restore proper positioning to the spine so that the nerves can flow freely and uninhibited without any interference. And when we do that, we also impact that baby's future, because then we see the babies can nurse easier. We see that the babies don't have colic. We see that these babies don't have ear infections. So while there is documented research coming out of some of the colleges about how chiropractic helps with back pain and colic and ear infection, after the fact, what we see with the patients, with the women, with the families who've been under lifetime chiropractic care, who've been under care throughout their pregnancy, who've kept their children under chiropractic care after the birth and into their childhood or their adolescence, we see that these families are healthier. There's lower incidences of sickness, lower rates of ear infections, lower rates of antibiotic usage, definitely lower rates of food allergies, asthma, and eczema due to those antibiotics that weren't used in the families who are under regular, natural, gentle, safe chiropractic care. We see such a difference in these families that I think that the people validate chiropractic more than any research ever will. You talk to any patient who's had one child chiropractic care, and then the next child with chiropractic care, and they will tell you it is night and day. The first child who went the typical medical route, the hospital birth, with all the epidurals and the Pitocin and failure to progress and the C-sections and not nursing and being bottle-fed, they'll tell you that that child was sicker, had more ear infections, had colic, was more likely to get sick when they started preschool or kindergarten or first grade. And then they look at their child that has been under chiropractic care since conception throughout the pregnancy, after the birth, and all through their childhood, and they will tell you that's their healthier child. So chiropractic is way more than back pain, neck pain, and headaches, and we as chiropractors have to embrace that and start teaching that to our communities and start teaching that in whatever form it is that you have the opportunity to share this message with, whether it's with moms groups or with internet groups or teaching across the country or around the world. You need to share that with the people that you encounter, whether they're chiropractors or patients, active patients or people in your community. You start sharing this message, and we start making the shift toward the big idea and really changing the world.
Dr. Cathy, thank you so much for sharing your passion, your enthusiasm, really for what's normal and natural for health, for optimal health. Any last thoughts?
Thank you for having me. I just want to say that I'm so thankful that you are doing this podcast, and I'm happy for all the families that you are reaching. And I'm proud to be a part of it, and with Educate, always proud to get out there and help educate families how to have a healthier pregnancy and educate the doctors how to communicate this message so that they can have a greater impact in their community, much like you're doing with your podcast, just helping everybody to improve their little corner of the world.
Thank you so much.